Imagine a treatment that not only tackles type 2 diabetes but orchestrates a symphony of blood sugar control. Meet Exenatide, Byetta, a GLP-1 receptor agonist rewriting the rules. Discover its mechanism of action, precise dosing dance, and how it tackles nausea and hypoglycemia head-on. Get ready to dive into this captivating narrative, where science meets individualized care, all in the pursuit of empowered diabetes management. Indications. Exenatide is an injectable medication used in the treatment of type 2 diabetes mellitus. It is indicated for individuals who have not achieved adequate glycemic control with oral anti-diabetic agents. Mechanism of action. Exenatide belongs to the class of drugs known as glucagon-like peptide-1 receptor agonists, GLP-1 agonists. It enhances insulin secretion from pancreatic beta cells in response to elevated blood sugar levels. Additionally, it suppresses glucagon release and slows gastric emptying, leading to improved blood sugar control. Dosage. Exenatide is administered subcutaneously using a pre-filled pen injector. The initial dosage is typically 5 mcg injected twice daily before meals. After 1 month, the dosage may be increased to 10 mcg twice daily. Adverse effects. Nausea, common especially at the beginning of treatment, usually diminishes over time. Vomiting, often associated with initial nausea but tends to decrease with continued use. Diarrhea, can occur, especially during the initial treatment phase. Hypoglycemia, particularly when used in combination with other diabetes medications. Injection site reactions, redness, itching, or pain at the injection site. Pancreatitis, rare, but severe cases have been reported. Watch for persistent abdominal pain. Weight loss, due to the delayed gastric emptying and reduced appetite. Management of adverse effects. Nausea and vomiting can often be managed by starting with a lower dosage and gradually increasing it. Mild hypoglycemia can be managed with adjustments in concomitant anti-diabetic medications and careful glucose monitoring. Injection site reactions can be minimized by rotating injection sites. Contraindications. Exenatide is contraindicated in individuals with a history of hypersensitivity to the drug or its components. It is also contraindicated in patients with a history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, MEN2. Use in special precautions. Renal impairment. Use with caution in patients with renal impairment. Dose adjustment may be necessary. Gastrointestinal disorders. Patients with a history of gastrointestinal disorders may be more prone to adverse gastrointestinal effects. Thyroid C-cell tumors. Exenatide should be used cautiously in individuals with a history of thyroid C-cell tumors or a family history of medullary thyroid carcinoma. Pancreatitis. Monitor patients for signs and symptoms of pancreatitis, and discontinue Exenatide if pancreatitis is confirmed. Hypoglycemia risk. Dosage adjustments of concomitant anti-diabetic medications may be required to minimize the risk of hypoglycemia. Exenatide is a GLP-1 receptor agonist used to manage type 2 diabetes. It improves blood sugar control through its mechanisms of action, which include enhancing insulin secretion, suppressing glucagon release, and delaying gastric emptying. While generally well tolerated, it's important to be aware of potential adverse effects, manage them appropriately, and take necessary precautions based on individual patient characteristics. Always consult a healthcare professional for personalized guidance and recommendations before starting or adjusting any medication.